But the beautiful thing about addictions is this. Other than when we're talking about psychological addictions, it's different than physiological addictions. Okay? So a physiological addiction, for example, someone's physiologically addicted to benzodiazepines, right? Xanax or Valium or whatever the other ones are. If your body becomes, your physical nervous system becomes used to it, so when it's not there, it goes through convulsions. You got to wean off those things. Alcohol, if you've been drinking like extreme amounts for a long time and you go through delirium tremens, I mean, if you've ever seen anybody in the ICU with delirium tremens, it's, there's like nothing worse. There is always worse, but it's pretty bad. It's up there with like the worst conditions you can be in. And in fact, to help the people with alcohol, you've got to actually give them some, what they call Librium, which is we used to use, which is the benzodiazepine, just to ease them out of it. But other than that, all the addictions that we have for food, that we have for each other, obsession, it's in the mind. It's in the mind. It's in the mind. It's in the mind. So it doesn't exist. It doesn't exist. You got to remember, it doesn't exist. So here's the difference. A guy's smoking cigarettes, and he stops. And 2 days later, you say, hey, you got a match? I don't smoke. Okay. Well, I didn't ask you if you smoke. I just asked you if you had a match. So the difference is, are you a quitter of something? I'm quitting eating food. I'm quitting drinking. That's what I am. That's how I identify. I am quitting eating carbs. Don't do that. Just become a non-carb eater. Become a non-smoker. Become a non-drinker. Don't even think, you're not quitting anything. As long as you're quitting something, you have a relationship with it. And that relationship gets stronger. You don't need to have a relationship with this thing. In behavioral psychology, we talk about putting behaviors on extinction. As you know, children will do anything up to and including suicide for attention, right? That's just the nature of human beings. Okay, we need attention. We need to be touched and hugged and acknowledged. That's what we need, right? We need that. Okay. No matter how cool you are, no matter how macho you are, no matter how beautiful you are, no matter what you are, you need that. You need to be hugged. You need to be loved. You need to be told that you're loved. Yeah, that's very, very important. So children will do anything up to, including that. So now what children have learned is that, well, hey, gosh, they don't pay much attention to me when I'm reading or when I'm doing something cool like, practicing karate, or I'm outside hanging out with the birds. No, only when I get in their face. So they learn to do that because they'll take negative or positive reinforcement. So we know that positive and negative reinforcement both increase the likelihood that a behavior is going to continue. So how do you eliminate completely? By putting it on extinction. That is by giving it no reinforcement. All right? So you don't answer a question. You walk out of the room. You leave. They get zero reinforcement and it goes away. Okay, well, the same thing with addictions of the mind. Remember, all addictions are in the mind other than the physiological components, right? Heroin has a physiological component. But heroin's easy. You don't have to be hospitalized. You just have to go through 3 days of hell. 3 days of hell, morphine, oxycodone, whatever those drugs are, 3 days of hell. You go through it, and then what happens? You are liberated from that. Now it's in your mind, because the question is, why does that person who's been completely detoxified 3 weeks later go back to it? They didn't have the addiction anymore because it's all here. It's in the mind.